And today we are talking about fibromyalgia. And fibromyalgia is not an acceptable diagnosis. When I said this on TikTok, it caused quite a stir, quite a controversy. People were like, what do you mean it's not acceptable? Are you saying it's not real? How dare you say it's not real? It's people like you who make it difficult for us. Did I say that? Did I say it's not real? Or did I say it's not an acceptable diagnosis? Is it possible that maybe some of you weren't listening? I never said your symptoms aren't real. Hello, the title of my book is It's Not in Your Head. I would never say you're faking it. What I said and what I am saying right now, today, and forever is that the fibro diagnosis isn't an acceptable diagnosis. Why? Because you should want more. Now, if you're here today, you're here for one of two reasons. You or someone you love received the diagnosis of fibromyalgia. All your various symptoms, and maybe you're pretty sure you have fibromyalgia because, you don't feel good. Either way, you're in the right place. I'm here to tell you, do not accept this diagnosis. So today, I'll tell you what fibro is, how it's diagnosed, what the treatment is, and why all of that is not enough. And then I'll tell you what to ask for. If you're on YouTube, don't forget to like and subscribe. Why not? It's free. Be kind. Do it. If you're listening on the podcast, watching, mowing your lawn or cleaning your dishes, as always, my hair looks amazing and I'm wearing the stethoscope that my wife bought me. And other than that, you're not going to miss anything. I have no visuals. Follow us on Instagram or on Threads at The New Method, and always share this with the people that you love because they need to be game changers in their lives too. And for those of you who don't know me, my name is Efrat Lamandre. I'm the NP with a PhD, and I invented the new method where we empower people to realize that their symptoms are not in their head. Fibro is called an invisible illness for two reasons. First, the symptoms are not visible. People can't see your pain. Your labs are normal. You're in distress, and no one can see it from the outside. It's invisible. But the second reason it's called invisible is because after a while, you feel invisible. After going from medical provider to medical provider, being told that you're fine, there's nothing wrong with you. Maybe you just need to exercise. Maybe you just need to lose weight. Maybe you should take an antidepressant. If you hear that enough over time, you will start to feel invisible. So that's why it's called the invisible symptom. Now, if you receive the diagnosis for fibro, you might for a moment feel like, oh my God, this is great news. Finally, someone sees me. I have a diagnosis. I'm not crazy. However, you'll soon discover the diagnosis of fibromyalgia makes you more invisible because it means that from this point forward, any medical provider will stop searching. You will be branded as the patient with fibro, and you will become even more invisible. And trust me, I know, a practicing nurse practitioner for decades. Many of my colleagues literally roll their eyes when the patient comes in with the diagnosis of fibromyalgia. You're branded as a problem patient. What is fibromyalgia? Literally, fibro means tissue, mya, muscle, and algia, pain. So it literally means tissue muscle pain. It's not a really original name. It just describes what you have in a different language. Thanks for being helpful. So what is fibromyalgia? A disease that's characterized by having a lot of muscle pain, tenderness, fatigue, and other symptoms. Basically, your body hurts all the time. And fibromyalgia is the diagnosis given when someone has this chronic pain that can't be explained by anything else. Listen to what I'm saying, and I'm going to talk about it again. Fibromyalgia is a diagnosis given when they can't figure out what it is. This is called a diagnosis of exclusion. That means they test you for everything else, and then they say, I don't know, let's just call it fibro. Sounds like a problem already. You're going to see why in a moment. So who has it? Who has fibro? About 4 million adults in the U.S., about 2% of adults in the U.S. have been diagnosed with fibromyalgia. That's the ones who've been diagnosed. There are millions walking around in pain just undiagnosed. The majority of the cases that are diagnosed are females, and most people are diagnosed on middle age, but it could affect any age. What are the symptoms? How do you know if you have it? The symptoms, they really vary from person to person, but at the base of it, the hallmark symptom is chronic pain all over that affects your daily life. That's the common denominator. And then there are some other symptoms. So you have this tenderness. The pain is associated with tenderness, a sensitivity to touch, and there might even be tender points. And it used to be that we diagnose people based on these tender points, but we don't do that anymore. Fatigue, patients with fibro have profound fatigue. They're exhausted. These humans are tired all the time. Sleep disturbances. So the people with fibromyalgia are tired, but they can't sleep. A lot of them have insomnia. Cognitive disruptions. something called fibro fog. You can have memory issues, concentration issues, decision-making issues, and overall your mental clarity is affected. And it can get so bad that some people really can't work. They just disrupts their entire routine. And then you have other symptoms you can have: headaches, abdominal pain, bladder problems, depression, anxiety, dry eyes. But you kind of have to have this pain and this fatigue and this mental clarity issues. And then there's a million other symptoms that can happen as well. So the next question a lot of people like to ask me is, how do you diagnose fibromyalgia? Well, that's the thing. You don't really diagnose it. I mean, you do, but you don't. And that's exactly the problem. As I said earlier, it's a diagnosis of exclusion, which means your conventional medicine provider will do all of the tests, everything they can think of. And when everything comes back negative, that means they exclude all other possibilities. They will assume you have fibromyalgia. That's what a diagnosis of exclusion means. It means everything. It's an entire process, and it ends with, we can't find anything else, so you must have this. Okay, bye. How could this be enough? This is why I say this cannot be enough for you. Of course, it doesn't make sense. This is why I'm telling you, don't accept your diagnosis, because just because they didn't find anything doesn't mean they should stop. But first things first. I always say this. If you're in this much pain, always first go to your conventional medicine provider, your PCP. Do not skip this test, and never, ever self-diagnose, okay? Because that could be really dangerous. No self-diagnosing, okay? So make sure you do all the tests your provider suggests. Don't skip it. Be as thorough as you can be. You don't want to miss anything. You don't want to miss a crazy pathology. Do the tests, do the imaging. And then if they land on fibro, you just say, thank you so much. And then you move on into functional medicine. And that is where you and I start talking. So if you go to your medical provider, this is the steps that they will do. Don't skip it. A physical exam. Of course, you can have a physical exam of your joints, your muscles, your tendons to see what's going on. Blood tests. I'm sure they're going to test you for diabetes, thyroid, anemia. Don't skip it. And if those tests are negative, they might do autoimmune issues, right? Checking for lupus, rheumatoid arthritis. And then if all of these come back to normal, you're getting closer to the diagnosis of fibro. Remember, there's no test for fibro. The diagnosis is made when everything else is negative. Now, they might do some tests showing inflammation, and those might be elevated, but that's a problem too, because you could be inflamed for a lot of reasons. It doesn't really point you in any direction. And I do want to say that there is on the market a new test for fibro, and it's basically a test, again, that tests for something called cytokines. But honestly, I don't have much hope for this test because cytokines are elevated in a lot of people, not just in people with fibromyalgia. So I'm not really sure where this is going. But you know what? It doesn't matter. Even if the test can tell you that you have inflammation, cytokines, it doesn't really give us the why. But why are you in pain? Why are you so tired? Why is this inflammation happening? Why is all this pain happening? And more importantly, what can I do about it? So whether we have a new miracle inflammatory test out there or not, it doesn't matter. You're still in the same boat.